Welcome, bienvenue to Massey College. I'm so happy to have you all here for this very important conference, important for Massey College, important for Canadian society. My name is Nathalie de Rosiers, and I'm the principal of Massey College. And I first want to acknowledge that Massey College is built on Indigenous lands, the lands of the Huron-Wendat, the Seneca, and it is the treaty land of the Mississaugas of the Credit. We want to acknowledge our duty of stewardship toward this land and the great privilege that we have to continue to be here. My first word will be to thank Constance Backhouse and Lorna Marsden, who individually came to me and says, we have to talk about childcare. This is the right moment to do that. So I just said, yeah, why don't we start talking to each other and put together this conference, which I think brings back and brings together specialist people that have been working on this issue sometimes for 50 years that are here with us. So I'm delighted that we have the depth of expertise here to discuss the issue. And also, I think I see in the audience people that are directly affected by the childcare crisis, people that spend a lot of money on childcare, that are desperate for good childcare, that really need it, that to be flexible to their needs. And we know that this is a crucial moment in the childcare debate. We are at the cusp of maybe trying to finally get to a place where we may have the possibility reflecting broadly our ambitions for national childcare. But lots of issues to be discussed about this. I wanted to just mention about how my own view, my own relationship to the issue has evolved over the years, and I've seen it so much, the individual pressures on women to accommodate their childcare needs in terms of their family, pressures of their community, and so on. Over the course of my career, I've seen it so often, both when I was a user of childcare, but also when I saw my children now struggling with having access to childcare, and also the pressure that it creates for them in their relationships to their community and their family. So, an unequal society is an unhealthy society. And if it continues to maintain inequality, it perpetuates it for generations to come. Childcare is certainly an issue of women's equality, gender equality, but also an issue of class equality. And I think we should not forget about our responsibility to ensure start for everyone in life. On this note, I'm just going to pass the mic to Lorna Marsden to begin our first panel. I want to acknowledge that we have two speakers who have had to send their regrets. Kim Kirkley, who was going to bring the Indigenous perspective on this issue, as a child who's sick. Grace is sick and she cannot come. So, and then Heather McGregor, who also is sick today. So we will acknowledge their contribution and hope to continue debate again with them at another time. Lorna.
Thank you very much, Principal, who I keep wanting to call Master, but I won't do that. Can I invite the first speakers to come up and take a seat on the platform and to say welcome to everybody. I'm so glad you're here. This is a crucial moment in the development of childcare in this country. Yes, we have a federal program, but it's not a program that's going to work unless we keep our eyes on the entire process as it transitions from federal to provincial and then to municipal application of it. It's very complicated. So I'm really delighted that we have three very experienced and knowledgeable members of this panel. We, of course, changed the program, so we're going to start, and I'm going to introduce you all and just ask you to keep going because I know your ideas flow. Professor Constance Backhouse, known to many people for long contribution to status of women issues in not only her own field of law, but more generally. She'll be followed by Morna Ballantyne, Executive Director of Childcare now, who really has a deep knowledge of the building of the system from Ottawa to downtown, Queen's Park. And Martha Friendly, who, as many of us know, has been working on this issue for, can I say, 50 years you've been working on this? 50 years. Yes, at U of T and more generally, and deeply, deeply knowledgeable. So very much looking forward to what you have to say. There will be a question or two between each speaker, and put your hand up if you have a question to ask. So Constance, lead off.
Thank you very much. It's a pleasure to be here. Thank you to Principal de Rosiers for allowing Massey College to host us. Thank you for everyone who's come out on a blustery day that snow is predicted. People in this audience who have had an enormous impact on the child care lobby. I just want to acknowledge Beth Symes, who is here, whose case went to the Supreme Court of Canada with her co-counsel, her lawyer, Mary Eberts, fighting for the right for fair taxation of businesswomen who were spending money on care in the same way that they were spending money on rent and bookkeepers. And she said, why is it that you can't deduct your child care expenses? And she made a brilliant argument. And I just wanted to acknowledge that she's here and that's part of our history. Okay. My title is How to Protect Our Fledgling Childcare Program. Is There a Roadmap? And I would like to start saying it's been a long road. Many date the campaign for a national childcare program to the 1970 Royal Commission on the Status of Women report, which was powered by a burgeoning second-wave feminist movement, which recommended federal funding for startup and ongoing costs. In fact, the draw childcare was one of the campaign pillars for Clara Brett Martin, Canada's first female lawyer, when she ran for the position of Toronto alderman in 1920. 3 different prime ministers then missed the mark on national program proposals. Brian Mulroney in 1986, Jean Chrétien in 1995, and Paul Martin in 2006. Although Quebec put the rest of us to shame with a $5 a day childcare program in 1997. In 2021, the rest of us began to see the light on the horizon when Prime Minister Justin Trudeau's government signed agreements with the provinces to provide block funding for $10 a day childcare through 2026. So why are we here today? First, although we've never been so close, we also stand on the brink with the prized program poised to fail. Several provincial governments disagree with the vision of non-profit centers. Most provincial governments are moving too slowly on implementation. The next federal election, probably just 2 years away, could result in pullback, the cancellation of the bilateral agreements, and a disastrous switch to tax credits for stay-at-home parents. The goal could be yanked out from us yet again. So what do we want? First, a rapid expansion to provide universal access to quality care for children of all regions, races, abilities, and incomes. Second, blockage of the expansion to private for-profit chains. Third, unionized childcare workers with wages and benefits that fit the extraordinarily important work that they do. Fourth, a childcare program that is attached to provincial educational services, providing a streamlined direct link to pre-kindergarten and public kindergarten classes. Fifth, all of this needs to be fully financed by lifelong universal taxation and funneled into our public budgets. So, how do we ensure that? I believe that success will require active and immediate leadership from the feminist movement. Now, when I put that to my feminist friends, full of cynics, said, "What feminist movement?" And my answer is the same one that lobbied successfully to get abortion and birth control removed from the criminal code, that achieved worldwide praise for our reform of sexual assault law, that established shelters for abused women, that brought new generations of women into the paid workforce, that demanded pay equity, that reformed family law, that fought for equality for women within the Canadian Charter, and that has been calling for access to childcare since the early 1900s. So, first, in the short term, we need to work province by province to ensure that what's been agreed actually happens. We need more spots, and we need better wages. Second, in the medium term, we need to insist that it does not get yanked in 2 years with the next federal election. I cannot emphasize this enough. Elections matter. We need to vote at polls to ensure that this program gets operationalized on the ground. Thirdly, long term, we need to ensure that we don't set up a piecemeal program that operates based on neighborhood centers that come and go. We need to be linked into the universal public education system. This needs to be part of ruling understandings. Okay, so what's our strategy? That's why we're here today. We need to talk strategy. And I'm a historian, so I've been looking back at campaigns that succeeded in creating some new change. For example, there was a group of people in Ontario who fought for the first human rights legislation in the 1940s. They started with a small organization, fewer than the people in this room. They went out and they built alliances with every group they could enlist. Religious groups, labor organizations, women's organizations, community groups. Today, we could add to all of those environmental groups, anti-racism groups, anti-poverty groups, disability rights groups, political parties, neighborhood centers, business leaders, and so on. Their success in getting that first human rights legislation passed followed after they gathered together 300 people to sit in one room with politicians. The legislation happened. Now, it's been a while since we have mobilized our feminist movement. Do we march? Do we lobby in the back rooms? Do we create petitions? Letter writing campaigns? Do we seek wider coverage from reporters, from media influencers? Do we repeat the educational sessions that we set up in the homes and church basements across Canada in the wake of the awful Murdoch family law judgment denying farm women equal access to their property on divorce? That succeeded. Do we call local meetings, provincial meetings, national meetings? Do we use social media? Do we not rest until we have 3,000 people gathered in a room with politicians? The feminist movement, of which I am very proud to call myself a member, second wave, as we were labeled, used every strategy we could think of. Radical idealists worked hand in hand with more mental reformers. We submerged our differences. We marshaled our energies. We cooked pots of chili for countless potlucks. We laughed until we cried, and we got on with transforming society. Some of us are in the last decades of our feminist capacities. This is our song, the biggest victory of all our efforts so far. We need to hand down a universal childcare program to the generations to come. And I would challenge everyone in this room and everyone within our reach to join us. Social change happens bottom up. This is the most important feminist battle we have mounted yet. Let's win this one. Thank you.
Thank you very much indeed. That was a wonderful start. Ballantyne.
I changed my notes at the last minute, so I have to use a computer. My apologies to those who can't see me. First, thanks very much to Massey College. Thanks so much to both of you for putting this on, for the idea, and happy International Women's Day. A few days late, but we're still celebrating. I'm going to speak about, the system, what kind of system we want. And that was incredibly inspirational. And I'm not actually, I don't have a battle cry. It's so good for somebody else to be making the battle cry. It's usually coming from the childcare advocacy movement, and we do need the feminist movement to rise up once again in support of probably the biggest piece of unfinished business from the Royal Commission on the Status of Women 50 years ago. So to understand better the childcare system we need, we have to understand what we have. And the first thing I want to say is we don't have a system at all. At least not the way we have a public education system, not the way we have a public healthcare system. What we have instead is a childcare market. So almost everywhere in Canada, childcare is actually a private transaction between those who purchase services and those who sell them. Except in Quebec, there's no legal entitlement to access early childhood education, and there's no public obligation to provide it. Governments regulate the market to some degree, and they provide some public funding. But it's important to know that the funding that's provided, almost all of it takes the form of parent fee offsets. It's really important to know, too, when we start thinking about how the parent fees are being reduced and how they're being funded by the public purse. Outside of public education kindergarten, there's absolutely no public provision of childcare, except for a handful of municipalities and a handful of school boards and a handful of other public employers like hospitals, universities, who have chosen voluntarily to deliver their services directly. And it's this market approach to supply that has caused the problems that we're in, and it's what has driven up high parent fees to, astronomical levels. It's what's responsible for very low wages and absence of benefits and pensions for staff, which is related, but not only the factor, to the very low quality of early childhood education in the country, the scarcity, the uneven distribution, and inequitable access and inclusion, and exclusion, I should say. So advocates cheered when the federal government announced in its 2021 federal budget that it was building a Canada-wide community-based system of childcare as a transformative project. The budget said, and I'll quote to remind you, just as public schools provide children with quality education in their neighborhoods, the government's goal is to ensure that all families have access to high-quality, affordable, and flexible early learning and childcare, no matter where they live. So it's understandable, given those words, that we believed that this massive federal government investment, $27 billion over 5 years, continued support beyond that of more than $9 billion annually, minimally. And so it's understandable why we believed that the federal government's initiative would take childcare off the market and make it possible to finally build a publicly funded, publicly managed supply of high-quality, regulated childcare services that are low cost or free for all children. After all, that's what we have in public education, right? So why not the same for early childhood education? In a very short period of time, as we know, the federal government did convince every province and every territorial government to sign on to the project through negotiated funding agreements. Each of these spells out a joint commitment, and again I'll quote, to support a community-based system of quality, regulated early learning and childcare, aiming for all families to have access to high-quality, affordable, flexible, and inclusive early learning and childcare no matter where they live. So the federal 2021 vision is in every one of those funding agreements. And each of these agreements has an appended action plan that sets what will be done. The first action plans in the agreements cover the first 2 years of the 5-year term of the agreement. And right now, at this moment, over these weeks and days maybe, the federal government is discussing with provincial governments what the next action plans will be covering the next 3 years. I'll just note that Ontario is following a bit of a different timeline because it was so late coming on to the system. So federal funding increases, also important to know, are going to increase each year over the 5 years. So Ontario received $1.1 billion of federal funds for 21-22, and by 2025-26, Ontario is going to receive just under $3 billion in federal funding. So what happens? What's happened so far when it comes to transition? Well, the reality is we've seen very little change in how services are delivered. So most provinces and territories are pretty much doing exactly what they were doing before, and they're using federal money to do it. That's what's happening. The only exception, and it's an important exception, is thanks to the federal initiative, parent fees have been reduced substantially everywhere. Just last week, we heard announcements from the Manitoba and Saskatchewan governments of the federal government that they will be reducing, putting a maximum fee, not an average fee, a maximum fee of $10 a day for all age groups starting April 3rd of this year. Everywhere, staff wages have gone up a bit, but almost everywhere it's been through what we call a top program. And wages are still grossly inadequate. Pensions and benefits are still non-existent, and as a result, the problem of staff retention is even worse. Expansion of the childcare system has been extremely slow, as Constance said. And that's mainly because of two things. There's been no public funding for the capital costs associated with expansion, or very little, and also because there's been no planning by provincial and territorial governments on how to expand, either no thought or will given to that challenge, and most importantly, staff shortages have been a major barrier. Each of the funding agreements, of course, sets targets for expansion, very ambitious targets in some cases, and each of the agreements requires progress reports. But the problem is, obligations for reporting, so far public reporting have not materialized, and we actually don't know how many new spaces have been created with federal funds. Although thanks to Martha's research unit, we will know that, have at least some of that answer for the first year of the program in a few weeks' time. It takes a feminist non-governmental organization apparently to hold government to account. The federal budget also promised to build a primarily not-for-profit system. For-profit provision has not been curbed, and in fact, recently the Government of Canada signed an agreement with the Alberta government to greenlight the creation of 22,500 for-profit spaces in that panel, even though they've gotten nowhere on expanding and meeting commitment for an expansion of 42,500 spaces in the not-for-profit sector. So what should we do? I think our focus in the coming years, next year particularly, or next 2 years particularly, should be governed by two broad goals, framed by two goals. Both goals for governments and for childcare advocates. The first is we have to lay the foundation for a universally accessible quality system. And that means changing how services come into place and how they're sustained. And the second is that we, and Constance alluded to this too, we have to make enough progress with respect to availability and access over the next 2 years so that whatever government is elected, federally next time will not withdraw the federal funding spending contribution because expectations will be high, expectations will be that it continues. I suggest that across the country, we push for, specifically, revised funding formulas so that services are funded operationally at a level sufficient to provide high-quality services. And that means funding has to be sufficient to increase wages and benefits and put in place pension plans for staff. We have to put in all kinds of measures, government move in a variety of different ways to ensure staff are retained and others are attracted to work in the sector. We have to have measures to increase quality that go beyond staff wages and benefits. We have to actually address the working conditions of staff in centers and also in home-based programs. We need planned, public-driven expansion, and that means public delivery. We have to get municipalities and school boards to directly deliver services, particularly important in Ontario, where some municipalities are already delivering, but have in the past 10 years closed down a lot of their own direct delivery. We need that back, and we need more. We need a moratorium on for-profit expansion, and we need, probably most crucially, a campaign, a massive public campaign, because we have to win public support for this project well beyond the early childhood educators, well beyond those who work in early childhood, and the minority of parents who have actually seen their parents reduce. We need to broaden the support. So I join you, Constance, in the call for action. Let's get this done.
Thank you very much. That's terrific.
Wait a second.
So, Martha.
Hang on a second. My mic is full.
Is it down your pants?
It's falling down. Wait a second.
A little technical pause here.
Technical pause here. Hang on a second. Wait a minute. Just talk amongst yourselves for 1 second. Okay. Got it. Good. Well, let me start by just thanking the organizers and the fellow panelists. It's great to see those I know and people that I don't know, and happy International Women's Week. We have really been drilling down on childcare during this week. I'm going to start where Morna has, just where Morna has left off by prior agreement, actually. If you look at the part, this is really about what do we need to do to make sure that childcare is indeed better and affordable and continues to improve. So Morna's talked about moving from a market to the system that we want, and I'm going to kind of expand this by talking, my title is Building a Quality Childcare System is a Very Long Game. So I want to pick up, and I'm going to build down on the three fundamental policy elements of system change that we're intending to focus on in the next year. When I say we, I'm talking about the Canada-wide childcare movement. I'm going to say a few words about that at the end. But the policy issues, as Morna defined them, and I'm going to talk about them, it falls to me to get into the weeds on childcare policy a little bit, so these are the three really like the building blocks of this system. Firstly is revising, transforming how childcare funding is set up. That is how to fund centers coherently, which we have never done, as Morna described. The second thing is ensuring that there's a sufficient qualified workforce, that is, qualified early childhood educators who want to come to work at this. And the third thing is we have to shift from relying on individuals or private groups of any kind to expand childcare services. We need to shift from this to planned public expansion, including the expansion of public delivery. So all of these three elements have to do with shifting away from the market that we have always had in Canada. It's always been a market, and we could detail what that means. But we have to move to a more publicly managed system. Why? Because everything we know, all the research and policy analysis that we've all been doing all these many years, and following the lead of other countries who have done this before we have, show that these will work better to make the childcare system that we want, to create of childcare, and that otherwise it will be quite hard to actually, come to that kind of vision. So I'm going to talk briefly about each of these policy elements. The first one has to do with this issue of operational funding. So here's a childcare center. It has never been so across Canada that it gets a budget based on how many kids, what the age groups of the children are and all that kind of thing. That's what we call operational funding. And that has to do with, does the childcare center, I just have to say parenthetically, I'm including regulated family childcare in this, but I can't say it every time. So that's part of what we envision as a system. But just to say that, does the child care center's budget cover its full operating costs, including compensation for the child care staff, which normally in a not-for-profit budget is really about 85 to 90% of, it's most of the budget. It varies a little bit depending on the age groups and so on. Now, although the federal government has begun financing the lower parent fees that we've begun to see this year, child care centers, and this is true across the country, still rely on budgets that are basically a hodgepodge. They're made up of parent fees, still pretty heavy reliance on parent fees, fee subsidies that replace the parent fees for lower income parents, now federal funding that replaces some of the parent fees for everyone, relatively small funds that are earmarked, usually in the form of wage enhancement for improving staff conditions, and other kinds of bits and pieces at times. And this may be predictable or not predictable, and also may be adequate. It's usually not adequate, but it may be more or less adequate. And essentially, the new federal funding in this first year has just been layered on top of the old kind of market hodgepodge way of financing childcare. If you look at the key shift to operational funding, this characterizes the things that we say this is the Quebec system, which isn't, it's not the whole system, but you always hear about this. Basically, that was the big shift that they made to finance most of the cost of the budget operationally. And any of the better developed childcare systems in Western Europe actually fund childcare this way. So as public funding increases to further reduce parent fees in the next few years, how the public funding actually is going to become increasingly important. So that's one really majorly important thing. The second, and I can't stress this enough, this will not be a surprise to anybody, the absolutely critical element of a quality childcare system that needs the most serious, well, they all need serious attention, but in the next year is the childcare workforce. And simply put, without a sufficient number of qualified educators to work in the developing system, not only will quality for children be impacted, which we know from a wealth of research, but it won't be possible to maintain the services we already have, let alone expand them. So that's why it's like kind of the linchpin of the whole thing. And this is already happening. You can read this in the media all the time. This center couldn't open its toddler room, or I'm surprised we didn't lose more centers during the pandemic. I mean, centers have closed. And I was going to mention something about the Toronto YMCA, but the Toronto YMCA is the Greater Toronto YMCA. I understand that out of the approximately 35,000 spaces, only about 19,000 can be filled because of the staffing crisis. That's what I heard. So that would, if that is true, that really, really puts it in perspective. The YMCA is a big deliverer of childcare around the country. So I just want to emphasize that the childcare workforce issues didn't originate with the pandemic. Recruiting and retaining qualified staff has long been an issue in childcare, but the pandemic exacerbated it. Our workforce is impacted everywhere, but we were a low-wage, poor working condition situation always. So you put those things together. And you have the current, I would say it's a crisis, and I think people understand it's a crisis. It's about more than wages and benefits. It extends to working conditions, lack of respect, lack of support, such as not enough, no paid preparation time, which teachers have, lack of professional development, and lack of career ladders. And it's not a one-issue factor. So their wages are central. But the childcare workforce issues really need to be addressed comprehensively, and also soon, if we're going to start making this Canada-wide childcare plan successful. So the childcare workforce, Morna said, issues are really linked to the third key element, which is expansion. Because expansion will be blocked if we won't be able to expand if we have, it's obvious, without an adequate workforce. But in addition to that link, it's clear that moving from expansion of services as a private responsibility to a publicly led planned process, so a majorly important element. We did a bunch of work on this and kind of traced, why that is. But just for anybody can relate to this, is you ask yourself, how does a child care center get there, like the one right down the street? Well, it's because some private individual or private group, it could be a parent group, it could be an entrepreneur, it could be a small or large entrepreneur. I started myself as a part of a parent group's 2 childcare centers, or reinforced one and started another one. And that's really quite common. But what it leads to is inequity and childcare deserts everywhere. And that's because this market model does not work. So if you compare this to how childcare expands in better developed systems in other countries, because I would say that Quebec has done this any better than anybody else in Canada, it's obvious that what's needed is a shift to more public responsibility for ensuring that childcare is developed where it's needed, it's for the right age groups, the right parent schedules and that kind of thing. Not that a private individual or a private group decides that that's what they can manage, and if they don't step up, there isn't any. So, and hand in hand with that issue is this issue of publicly delivered childcare. It's really important. This is really important. This is not remotely to denigrate the not-for-profit childcare sector, which I come from as a parent. It's just to say that in and of itself, the not-for-profit childcare sector cannot on this task. And if you look internationally, you don't see any country that has a well-developed childcare system where the bulk of the childcare is not publicly delivered, usually at the local level. Like some of it, what we would call childcare in some countries is part of the public education system. The École Maternelle, for example, system in France goes down to age 2.5. It's now compulsory. So there are different choices to be made about how we do this. But I mean, all of these things are policy issues that come into this. So, these aren't trivial shifts that we need to make to implement this ambitious childcare system. Our collective roadmap actually sort of talks about these kinds of things. But it's also important to know that we've just finished the first year of this game of building a childcare system. So that's an important thought to be to hold. So to close, I want to make 3 points related sort of to the process of advocating, because I couldn't agree and applaud more that this is our task, is to continue to work on this, and more and better. So I guess I want to say 3 things. One of them is how important it is to get this right from the start, to get the architecture right. We're laying the foundation right now. And if we're building a system, we need things on which to build. So the best example, I could come up with a million examples of this, but some of the things are changeable or mutable, and some aren't. One of them that is been shown in other countries, a major problem, if you bring this in at the beginning, is relying on the for-profit sector, which has become increasingly internationalized, to build your foundation. If that happens, it will be really hard to ever turn that around, which is what other countries have found. It really will be impossible to build on this basis a universal equity quality childcare system, which is what we want. If a lot of the services are privately owned, and you can see this in other countries, like really, really clear when you look, you look at the policy. The second thing I want to emphasize is this is a long game. And this means that progress may be stymied or blocked by uncooperative, hostile governments. And we've all experienced this. I just want to comment, Constance, that almost every time we lost what seemed like a promising childcare initiative, it was because of an election. And I want to add to the list, I can't help but say this, is that Trudeau's father, Pierre Elliott Trudeau, commissioned the first federal report on childcare, the Report Task Force on Childcare, called the Katie Cook Task Force, actually, which was tabled on International Women's Day, 1986. So it was after the Liberals were out of office, but it was still tabled, and that also was lost because of the election of the Mulroney government. So. But I just want to say this has been par for the course for childcare, but you have to keep in mind that governments do come and go. And we're still here, standing at this, the podium. No, I mean, seriously. And it won't go on forever, but we do have new generations coming along. So this is really, really a good thing. But it's well that you have to assume if you have a recalcitrant provincial government, let's just take Ontario as an example at this point. We know that the Ontario is one of the recalcitrant ones in the scope of things nationally. So the trick really is you have to figure out how to tailor your advocacy to that kind of situation and get out of it what you can, because they're never going to do really what we want them to do. And sometimes the objective is to use everything you can to prevent them from really doing harm. And I really feel that way very strongly, that it's important to keep advocating with different strategies, no matter who's in Queen's Park or who's in Ottawa. And I guess the third thing that I just want to say is it's about the childcare movement. The childcare movement actually was instrumental in putting this as it is on the national agenda. I have to say, not only because it ended up being lionized and all that kind of thing, but a good deal of the policy framework, the roadmap that we've been asking for in increasingly detailed ways for 50 years is on the agenda. So the childcare movement has had a lot of solidarity, I say, across the country, across groups. I actually was, somebody from the ILO approached me at an international meeting some years ago and said to me, Canada is the only country that has a childcare movement like this, kind of a popular movement that brings on all kinds of sectors. We've brought in many new sectors with this iteration of it. And I really want to emphasize that to accomplish all these things, we need to continue building the childcare movement with more people, new allies, but keep our eye on the core of what it is that we need. I think without this, there won't be any way to push, and I think this is part of it. You have to figure out how to do this. How do you push willing, enthusiastic governments to do it right, because you do, and how to keep recalcitrant governments from doing the wrong thing? So those are the thoughts I have about going forward. I couldn't echo more that we have a great deal of work to do, and we need to get together in order to do it. So thank you very much.
Well, thank you, all three of you. It's what a wonderful image of what is before us that we have to keep working on. I'm sure there are going to be questions, but I'm waiting for your hands to go up so that the microphone can come to you. I would like to ask all of you to comment on the fact that in Ontario, unlike other provinces, we have both the involvement of the federal government, the provincial government, and the actual implementation is in the 47 municipalities. No, not 47?
Oh, no, there's 47.
Yes, that's what I thought. Where they have to think about this. And all of us know people in these municipalities. I've phoned in a lot of people I know at City Hall here. Are they ready to do it? Opinions differ.
Good question.
I'd like to know in this province whether you think we are now in a position to actually implement what the provinces have agreed.
Should I go first?
By all means.
Should this be at the podium?
I think it's
I
on.
think you can do
Okay.
it from your chair. Is
So,
that right? Yes, you
so
can do it
the
from
thing
your
is,
chair.
you're quite right that Ontario is the only province that has a mandated municipal role to actually administer the system. Don't forget that municipalities are creatures of the provinces in Canada, and their degrees of freedom and their financial ability is quite limited, unlike some other countries which have things organized differently. But that being said, I think it's a huge asset to have a municipal role, and I think this is something we really need to do more work on. So the question is, how much can they actually do unless the province wants to do it? And I think that that's, the answer to it is it depends on what it is. So if I can give you a couple of examples, if I may. In Ontario, over the years, a number of the municipalities had, one way or another, tried to curb the funding of for-profit childcare in their municipalities. Toronto kind of led this with a buy. Are you okay? So, and as over the years, different, they started using quality tools and saying we're not going to fund you unless you make this level of quality and things like that. But the bottom line is that just recently, in the last 2 years, I think, Carolyn, is this right? The Ford government said, we're not going to let the municipalities do that anymore, have that kind of discretion. So that's an interesting question, like they have the authority to be able to do that. So I guess in answer to the question, I think the role of municipalities, and I'm separating the role of administering childcare, which is mandated in Ontario, and childcare, which is majorly important through the urban, and service planning process. Another role is actually delivering public childcare, which they were never required to do, but many have done. And those two aren't exactly the same role. So I think the municipalities, a lot of them are very good at doing what they do. They can really put things in place at the local level, which I think is also majorly important. But if the province isn't willing, then the municipalities may need to be involved in pushing the province to do the right thing. So I think it's a complex question that has a lot to do with like governance structures and legal roles and responsibilities. But I think I'm actually planning to do some work on this as soon as I finish doing what I'm doing, because I think it's majorly important as a structural piece of moving it forward, and that would definitely be true of publicly delivering childcare as well as doing urban planning and doing other kinds of things that we're kind of talking about here. I don't know if that answers your question.
I think that's very important. And if I may add to that, one of the people who unfortunately has COVID and therefore is not here is Heather McGregor from the Toronto YWCA, who was explaining to me that under the system that has been put in place in this province, the administrative costs are going to be extremely heavy. And I gather the YMCA operates over many municipalities. You may want to comment on this. Administrative burden changes from municipality to municipality, and those costs are going to be an additional serious burden on the limited funds that come from the Y. So that's an example of
It's
it.
an example.
I think we all need to phone everybody we know who lives in a small town in this province and say, how are you going to get childcare, for your child? We have a question here. Can we bring the microphone?
Oh, I can talk loud.
No, because of the recording. This is streaming.
Thank you. Thank you, of course, for all the comments. I just wanted to complicate the municipal question a little bit, and my name is Pamela Opal. I'm from the Ontario Nonprofit Network. In speaking to our urban Indigenous partners in Ontario, so actually don't want Indigenous childcare to be administered through municipalities and so I'm talking about urban Indigenous communities, and they want to friendship centers to administer that, and are sort of, asking for that recommendation, and sort of pushing that forward, because I think the current system doesn't speak to urban Indigenous folks, mostly on reserve, and then of course the system that we're talking about. So yeah, just wanted to throw that out there, and sort of how do we do allyship in that and sort of push forward that conversation as well.
Thank you very much.
Oh, I was going to say, taking that up, I mean, Carolyn Fern's Ontario Coalition for Better Childcare. We've spoken with the Ontario Federation of Indigenous Friendship Centres, and from their perspective, there's a gap in where they fit in this system, because we have the Indigenous early learning and childcare system, but that's it's about on reserve, it's about Inuit, but urban Indigenous childcare programs are really missing in this, and so that's a conversation to be had. But to your point about calling up, who can we call up? I think that is in Ontario a huge opportunity, because as we say, Martha, you said we have a recalcitrant provincial government, but we do have several progressive municipal governments that could be convinced to take this on in a big way. And that's one of the ways, that we move forward in a situation with a recalcitrant province, is that we look for the places where it can be moved forward, municipalities where, we could see a big change. I think right now, Hamilton might be an opportunity, right, with their new mayor, a place where currently they operate one municipal childcare program. They could operate many more, they could expand there. So it's really something that could be taken up, and I agree we should be in touch with them.
Thank you, Morna.
Yeah, just picking up on the municipal theme, just a few thoughts. One is that the federal government, since 2015, has really tried to strengthen its direct relationship with municipalities. And I think that has some potential nationally. Especially with respect to building the capacity of municipalities to provide funds, capital funds. So there's money being transferred directly from the federal government to municipalities in various ways, include for capital, especially around green projects. If ever there was a green project, it's building childcare. Right? Especially if it's done well. The other thing, just briefly on the municipalities in the Ontario Nation, it's not the only province where municipalities deliver directly childcare. It's all been voluntary, as it has been in Ontario. But let's be clear, one of the main reasons that municipalities in Ontario and elsewhere have withdrawn support for direct delivery and relied on a not-for-profit, in some cases, and in some cases a for-profit delivery model, is because it's cheaper for them, because the wages and conditions in the not-for-profit sector are significantly lower than the municipal sector. So one of the things which was the case in Ottawa, where I'm from, and it might be true for Toronto, the city had a policy for a long while where it would ensure that the wages and working conditions of those who work in the community sector had to be the same as the municipal sector, so that, that huge achievement, but that unfortunately has been abandoned. The problem with that is that we don't want to put the cost of childcare, I don't think, on the property tax base.
That's right.
It is inequitable, it's not the way to do it. Anyway, I think I'll leave it there. Just in the Indigenous, we have said that all the building of what we call the Canada-wide system has to also be built on the foundation of the Indigenous early learning and childcare framework that was arrived at by the federal government in an incredible, I think, process of co-development, co-policy development between the federal government, the Assembly of First Nations, the ITK representing the Inuit and the Métis Nation. And so everything that we do, on reserve, off reserve, has to be in line with that framework agreement.
Lorna, can I just make one little comment?
Yes, and then we have a speaker from the other.
Just as a comment, in collecting up all this data from across Canada that we're just finishing, like several previous CRRU researchers are here, so they know what kind of a process it is. But we have discovered that there is publicly, particularly municipally run childcare in many more places in the country than we realized.
Small places.
For example, it's very small, but it's there. So in the territories, there are hamlets actually operating childcare. And talking to the provincial officials, they said, well, how are we going to get nonprofit who's going to be on a nonprofit board here to run a childcare center? There's municipal childcare in PEI and New Brunswick, very small, and a lot growing in British Columbia. So that's one thing. The other thing is, if you think about it, there are Indigenous governance organizations, the official recognized ones, are publicly operating their childcare. So we counted that up as public, so that would be on reserves and in Inuit lands, which really cover the two smaller territories. And the majorly, like as Morna, you can see the First Nations, Métis, and Inuit issues kind of rolled up. But the way it's kind of structured is that there's quite a big difference between the way it's approached on reserve and Inuit lands and what you'd call everything else in the indigenous world, which is exactly where friendship centers are just nonprofit organizations getting a license for a childcare center. And so that's a really interesting thing about how that actually should work. It still needs a great deal of work from the Indigenous sisters and brothers, I think.
Thank you. Question here, if you've got the microphone.
I'll pass it over. So my name is Nate Erskine-Smith. I have a question about politics first and then about the province. So first, when we were at the federal level negotiating these agreements, and then when we were, especially here in Ontario, one of the challenges was the number of for-profit independent operators who were also in many cases entrepreneurs who were women-led, and they were very vocal about, with the province in particular, about the realization of the details and how it would affect their businesses. So when you say, I think rightly, that we need to have an approach that looks at the architecture and gets it right first, how do we navigate the politics of that is one question. And the second question is, say we don't have a recalcitrant provincial government, and we had a provincial government who cared about these issues, what are the 1, 2, 3 things that the provincial government ought to be looking at in order to get it right?
Well, though there have been very structured I'm sure you know this, lobbying efforts that kind of cross Ontario, Alberta, Nova Scotia, to some extent BC, that have kind of formed up, which isn't new in childcare, right? And but the thing that is really new, and I think this is really important to think about, is this issue of being backed by private equity firms. And I can tell you that from like talking to people in other countries, looking to see who's doing what, and having been personally consulted as a potential consultant by multiple, I mean, the childcare folks need this. The way these companies make money is when there's public money that's loosely tied. And you can look at the history of this in Australia. The UK, I think, is the worst at this point. All of the countries that don't have well-developed childcare systems, and some of the better childcare systems. So the politics of it I agree, are really difficult. So the saw-off for the childcare movement was grandparent the existing ones, don't allow them to make windfall profits. And the way we had proposed doing this was having a wage scale so that they had to at least pay decent wages, and having a set fee, which a number of the provinces already have set fees. And by doing that, you could put some fences around them. So the lobbying efforts really have paid off in all of the provinces to kind of scare the provincial government, or maybe some of them were much more enthusiastic about it, there's a variety, into backing away. But I can tell you, I actually think, my own personal view, because I don't mind doing this, I think we should actually be saying don't license anymore for profits, because they're going to be, let me give you an example. Newfoundland has the highest share of for-profit childcare of all theirs. It's primarily for-profit. And the Newfoundland is not having any expansion in the for-profit sector. Why? Because they've decided that it is not an advantage to what they want to do. They're opening preschool, junior kindergarten, but they're doing it as licensed childcare, and it's going to be run by the YMCA, nonprofit organization. So I do think that there have to be places where a stand, and I think the stand absolutely is on expansion. And I think there have to be, some real boundaries put around it, because I don't know how to explain it. These companies that are doing assetization and financialization, they're good at this, and they have money, and they're going to push the boundaries because they just see Canada as a country that they haven't populated yet. And if you look at the research on this, where money has been made, it's when there's public money available. And that's exactly the situation you're in, if that answers your question.
Yeah, I don't know if you have some thoughts about maybe that does answer in terms of the priority focus going forward. Just if you did have a more progressive provincial government here in Ontario, the 1, 2, 3 things you want them to do.
This discussion will continue. Let's hear from our colleague from Y.
Hi, my name is Jameson Stevie. I'm the Chief Strategy Officer at the YMCA GTA. So to answer the stat questions first, we're between 16 and 17,000 spaces filled of 35,000 of licensed spaces. So for YMCAs across Ontario, to get back to pre-COVID levels, we require 1,400 childcare providers. So once his own estimates to hit the plan, it's 14,700. So 3 points. One would be on the municipality front. I'd say operationally we're having some challenges because we have 5 different municipalities that we interact with as the YMCA of GTA. Each of them have taken a different approach to funding. Each of them have taken a different approach to the legal agreement. So back to and there is no coverage of the administrative costs associated with working with. Now we know we're unique in that regard, so it's a tough lobby. Could you please direct all the municipalities to do it a specific way just for us? But I think we're probably not alone, but we're probably unique in that regard. But I think the funding piece, do you fund on capacity? Do you fund on operations? I think is one that could probably be directed by the province a little bit, hopefully, like to give them some more guidance, at least to the municipalities, on how that money flows.
That's right.
To your title, the Strategies for Better Childcare, I fully agree with. So I know most of you, or many of you. I was principal secretary to Dalton McGuinty when full-day kindergarten was brought in. So I've known you on the other side of the aisle as well. But it's also an example of a program that was brought to life so that it had enough life by the time you went to the polls that you could demonstrate its utility to actual real people who might actually show up at a polling station. And so your strategy, I would fully get behind. I would augment your incredible feminist thrust with an economic argument. Because the lived experience of most people over the last couple of years has been my economics are severely impacted when there is no other childcare, and my Zoom calls are interrupted by cats and kids, and so that there is a strong argument to be made there. I would argue putting specifics around how many childhood educators we need each year for the next 2 years to demonstrate real progress, because government, it's easy to dismiss a number like 14,700. It's harder to dismiss a number that's a little bit smaller. To Nate's question, a wage grid, quality metrics that link to performance in school, and a specific number of childhood educators, a human resources strategy, if I was writing a platform. Not that I don't do that anymore, but I wish you well. But thank you, and thank you for your decades-long business. It's really interesting to be a part of, so thanks.
Thank you for doing this. Beverly Talking, an entrepreneur. I'm not sure where this fits, but I'm throwing it out as an idea that maybe can be used to enhance where we're going. What about professionalizing childcare workers and early childhood educators? Professionalizing them, starting with the universities and the colleges, getting them to change and improve their curriculums so that in the end we have more people who are attracted to the sector, are better educated, have a sense of pride. Childcare workers are an exceptionally really important group of people in our society going forward, and we don't give them enough credit. So let's start with professionalizing that sector, work universities and colleges to get them to also be the promoters of the sector. In the end, they're going to improve their bottom line by having more programs, more students, and maybe even a higher profile and a more societal benefit.
And in our first speaker after our break, Laura Ritchie is focused entirely, on that issue of the workers and the, am I right, Laura? Labor, these issues which are so crucial. It's a very important point.
Can I comment on that?
Stephanie Bowman.
Yes, good morning, everyone. I'm Stephanie Bowman. I'm a relatively new politician. I'm the MPP in Don Valley West. And, I was a working mom. I really was interested in the Quebec model from an economic standpoint during my career in business, in banking. And I am in favor of a public system. I want to say that from the outset, but I got very interested during the election, just after I was elected, because I had people reaching out to me saying, how do I understand and implement the new rules, quote unquote, right? And so I did lobby in Queen's Park to say, let's get it at least extended because people aren't understanding. But I guess I just want to kind of come back to the question around, what was the word Martha used, I think, stopping the new spaces, right? Is there an argument to say we need to get the for-profit, the not-for-profit, the municipal aligned around this vision for a public system? I understand the private equity model, and I know exactly what you're talking about. That's the same like in housing, it's happening in these other places, right, where they're trying to capitalize on these public streams of funding. But is there an argument, do we, kind of, as a movement, kind of unite the current players and get them to talk about the value and, again, the economic model of a public system? And how do you feel the progress is on that front?
Thank you. Morna?
I would, I had a really interesting discussion with the Conservative lead federally for early learning and childcare, and she said to me, there's got to be a way to balance all these interests. We have to find a way to bring people together. And I would say that it would be much easier to align the not-for-profit, public, and for-profit sector as it is currently constituted if there was a moratorium on expansion. If there was an agreement that there would be a moratorium on expansion. Because then we could really get into some good discussions about what to do with the existing provision and how to organize it and how to ensure that existing supply continues, doesn't decrease, and that the quality improves. On the issue of professionalization, people use the term professionalization in different ways, but there's no question that the quality of early learning and childcare in Canada is not what it has to be. It's just not good enough, and one of the main reasons for that is the qualifications of staff, of all staff, are not high enough. The system, right as it is now, is running for the most part on with educators in programs with barely any formal training. That has to change, but it's going to take a long time to change that. And that is one of the resistance around the for-profit, because the big question is the wage issue and the benefit issue. And it's also, another big issue is the value of the capital holdings, the real estate. That is a huge issue. It's a point of contention, and I think it will only no longer be a point of contention if those who own privately real estate values understand that they're not sometime in the future going to be able to sell off these assets for enormous profits to equity-backed firms. So we have to stop it. I believe in a moratorium in licensing. I don't actually believe that for-profit should be able to be licensed and operate outside of the system. It's a two-tier approach. We've seen it in healthcare. It's not one we want to follow. So that's what I would say. Yes, align, but let's start with a moratorium.
Thank you.
Hi, sorry. Rachel Vickerson, Executive Director of the Association of Early Childhood Educators Ontario. So I just wanted to come back a bit to that idea of recruitment and retention. And we hear a lot about bringing people into programs, celebrating and doing ECs so people are brought in to EC programs.
in Ontario, we've had, and this is a bit different than other places across Canada, we've had a massive professionalization of early childhood educators over the last 10 or 15 years. We're the only province in Canada that regulates the profession. Of course, not everyone in licensed childcare is a registered early childhood educator, but half of the people are here in Ontario. We have initiatives to bring people into the sector. We have free tuition programs that were funded by the federal workforce dollars. We have fast-track programs also funded by the federal workforce dollars. The province has designated those federal workforce funds that are separate from the sort of larger pot of money to not be used for wages. We know that wages and a salary scale, not just a wage top-up, is what is needed. That is the main we need to be laser focused on is retention. You know, we all can talk about people coming in. I was in a class of 40 ECE students at Sheridan College in Brampton yesterday. They're all excited to enter the field. They're optimistic. They're so excited when we talk about the Canada-wide system, but we know statistically most of them won't be there in 5 years. So we really need to focus on keeping people in the field after they've entered, and we can do that through salary scale, pensions, work.
Thanks, Rachel. And just to pick up on that and go back to your question about what the three things an Ontario government could and should be doing. So the Ontario Coalition for Better Childcare, we had a campaign for years, the 3 big ideas for childcare: affordable fees, decent work, and enough spaces for all. So what does that look like in this context? It looks like just what Morna said, directly funding of these childcare programs with 2 things in place: a maximum fee of $10 per day and replacing the subsidy system with a sliding fee scale. A salary scale, as you were saying, for early childhood educators and childcare workers. And then, as we're talking about, putting a moratorium on the expansion of for-profit childcare, grandparenting in the existing spaces, and having a massive and long-term plan to expand public and nonprofit childcare.
I'm going to call on the principal in just a moment, but I do want to say that one of the reasons I went to the principal and said, we really need to talk about this, because I discovered that in a university women's club, and there are many, many of them in this province, the one I was talking, when the federal announcement, they said, oh, it's done, we'll move on to other issues. And this, to me, is about explaining this isn't done. There are a lot of experts in this room, thank goodness, and we're grateful to you for being here. But we also have to get it out to the interested public. Principal.
My question was about the childcare deserts that you described. And it'd be interesting, I thought, as a research project to develop the map of the childcare deserts, so that we can at least
It's coming out soon.
It's
it's coming out soon, so that's good. That's good.
About a month.
We should circulate it, because it's an opportunity, it seems to me, in a transition place, when build it right when you have the chance to start somewhere and respond to a particular lack of it. So I'm happy that you're talking. Is that a vocabulary that we should be using more often?
Yeah.
Childcare desert, food desert, and so on, to recognize the inequities within the system. And my question is, how do we know whether there is a desert or not? Like, it's, so that was my
More
question.
than 3 children out of 10. It's just a definitional thing. We need to have this is a really interesting kind of thing. The federal government is promoting expansion, but there has been no discussion whatsoever about what is appropriate coverage, how should it be done, like all of these kinds of things. I may make a point here. We had really hoped at the federal level for there to become a critical mass of, the thing that pulled all the provinces together and did the kind of policy work that, could, so they wouldn't all have to be reinventing the wheel. So in doing this project, actually David McDonald at the Canadian Centre for Policy Alternatives and I and several others in the room have reviewed it. So we're doing this piece of work on childcare deserts. But the question is a postal code the right unit of analysis, because there are different sizes. So that kind of thing, it's a policy discussion, and somebody has to conduct it. Otherwise, we still continue we talk about these things amongst ourselves either, but there's no official kind of way of pursuing any of these kinds of majorly important policy questions. It's like the infrastructure and glue really needs to be strengthened.
A comment, and then we have an online comment.
Okay. I find it amazing how much information we actually do have, and how many knowledgeable experts, policy creators, people in the workforce we have. My role here, I think, is to figure out a campaign. And so I was heartened to hear that the municipal level is another good strategy for us. We've always, as women, had greater access municipally on the political frame, and so that's good news. But I think every time we see a new opening somewhere, we should be canvassing how do we get into it and how do we make a dent. And so I want us to keep our eye on the campaign as we finish with this panel and move on to the next and through the conversation over coffee. We need to win, and to win we require all the brilliant strategies that feminists developed over the last 4 decades. I admit we have lost more battles than we've won, but it's not for lack of trying, and it's not for lack of strategies. We need to pull all those out and talk today about where we go from here.
I just want to briefly comment on campaigning, because that's what we do, is we campaign, and just highlight a huge challenge that we have. Would love insights maybe during the coffee break on this, is that when it comes to childcare, this is probably true for other policy areas. When you campaign, people want slogans. People want to campaign around simple ideas, and childcare is complex. So, for example, it's not enough right now to say we need more, because we don't just want any. And it is actually the for-profit, equity-backed sector that is positioning itself as the solution to addressing the gap between availability and demand. And what we know with the dropping of the fees is demand has increased hugely. And it is in the criticism that can be levied right now, and it's a legitimate criticism, is that a very small proportion of parents who have access to licensed childcare are seeing their fees. And so they end up disadvantaged. They get access to licensed childcare, which generally is of higher quality than unregulated, and they get lower fees. They're paying less. People are going to say that's unfair. And a lot of parents and others are saying that's unfair. So they're demanding more. And they're saying, we don't care who delivers it. We don't really care what the childcare name is called or anything. We just want it. That's a problem, because now if we're going to publicly fund, and we're moving to a fully publicly funded system, it does matter that it's public, not-for-profit, and not-for-profit. Quality is affected by auspice. So we do have to get into the details, and that's our challenge.
That's right.
And so we need to do both. And I think it's through having some actually more detailed discussions around policy, and to accept that people are pretty smart, and the public actually does want to understand policy, but we need thousands of people to help us engage and have these and lead these conversations.
Quite right. How do we... So somebody is saying their waiting lists for childcare on average 1.5 years at the moment or more. Targeting access to this space for everyone in a timely manner is just as important as the financial aspect. Would you like to comment on that? Last comments before coffee break.
But that's the point. I mean, that is the point. I mean,
She's right.
You know, just to say that when we embarked on this with our federal allies, we said you have to do these things simultaneously. So on the one hand, it was I think we all thought it was a really smart political move to really put out there, we're going to make childcare cheaper, because it was a big problem. It's still a problem for some people, but the fact is that it really got the public, parents engaged. But it should have been started, the other things that we're talking about should have been positioned at the same time and gotten started. I guess that's what I'm saying. there's an implementation gap. I would call it an implementation gap. So this issue of the workforce, it didn't just like spring up like, oh, what a surprise, like whatever. So we were saying you need to have a national workforce strategy. We were saying that, a year and a half ago, 2 years ago, when this thing gets rolling. I kept like a broken record saying to the federal people, you really need to require the project to develop a concrete expansion strategy as part of their agreement. They might vary, they would vary, but help them to do it and to kind of play it out and provide the glue or the support in order to do that. So I think we're late in getting started in these things, and I mean, really, the clock is ticking. So the person is completely right. Waiting lists have always been a problem. They are uneven. If you really look at lists, Better Childcare has bigger waiting lists, which, I mean, parents are sometimes desperate, but they know what they prefer. Like you see in Quebec, for example, where there are 2 tiers. The funded, the one you always hear about, the funded sector, which is mostly not-for-profit. And then you have another whole kind of sector that was introduced with a tax credit as unfunded, so they don't get operational funding. And parents in Quebec, it's like a given. They move their kids from the market centers to the Centre de la Petite Enfance as soon as they can. And so parents, are juggling this kind of thing. They really need childcare. I mean, that's one of the reasons. I mean, research shows pretty much, except for grandparents, that's why people use unregulated childcare by and large. Do something so women need to go to work. And they do their best, and sometimes things turn out really badly, and sometimes they're fine. But I guess the way to think about it is the way what the OECD said to Canada in 2004, when we were reviewed, is that the way we're doing it on the backs of low-paid, unregulated women, many of whom are racialized and, low income, is inappropriate for a country like Canada. And so then, 2 decades later, we're introducing a childcare system because other people have realized that that's one of the factors, but it's only one of them. So all of these things play a role. So waiting lists, there is no way to snap your fingers. You can get started on it. We see childcare is opening up because of the federal funding. You can see these little notices in the newspaper, but it needs to be more like in the right places, more of a plan thing. If that answers the question, it's just inevitable.
Thank you very much.
Yes.
Thank you all very much. You're really tremendously inspiring on this subject. And I'm really looking forward to talking at the coffee break with a lot of you in this room who know a lot about it already. And what we need to do the next time, Principal, we talk about there at Massey College, is have a lot of people who really don't understand. They're desperate to get a space. They don't understand how it works. There's a lot of work to be done among the various levels of politics on this still, and public servants. So we now move into the senior common room, coffee, things to eat, and I'm going to ring a bell very loud. I have to come back. Thank you all very much. Thank you. That was terrific.